Chronic fatigue syndrome. Chronic fatigue syndrome is a complicated disorder characterized by extreme fatigue that can't be explained by any underlying medical condition. Fatigue may worsen with physical or mental activity, but does not improve with sleep or rest. Chronic fatigue syndrome has also been called myalgic encephalomyelitis and, more recently, systemic exertion intolerance disease. Cause of chronic fatigue syndrome is unknown, although many theories from viral infections to psychological stress postulated. Some experts believe chronic fatigue syndrome might be triggered by a combination of factors like a weak immune system, an imbalance of hormones or psychiatric problems. Most likely to affect women, and the age groups that are most susceptible to the illness are teenagers between the ages of 13 and 15, and people in their early 20s to mid-40s. Main signs and symptoms of chronic fatigue syndrome are loss of memory or concentration, sore throat, enlarged lymph nodes of neck or armpits, unexplained muscle pain, pain that moves from one joint to another without swelling or redness, changing headache of a new type, pattern or severity, unrefreshing sleep and extreme exhaustion lasting more than 24 hours after physical or mental exercise. These can lead to depression, social isolation, lifestyle restrictions and increased work absences. Chronic fatigue syndrome is a very challenging disease, affecting multiple systems of the body. So far, there is no single test to confirm a diagnosis of chronic fatigue syndrome. But, researchers at the University of California San Diego School of Medicine have identified characteristic chemical signature to identify this disorder. Findings were published in Proceedings of the National Academy of Sciences. Robert K. Naviaux, Professor of Medicine, Pediatrics and Pathology, and Director of the Mitochondrial and Metabolic Disease Center at University of California San Diego School of Medicine, is the first author. The researchers used a variety of techniques to identify and assess targeted metabolites in blood plasma that have brought to light an unexpected underlying biology. Researchers found that individuals with chronic fatigue syndrome showed abnormalities in 20 metabolic pathways. Interestingly, it is chemically similar to the dormant states seen in some organisms, which slow down in metabolism to permit survival under conditions that might otherwise cause cell death. This slowdown comes at the cost of long-term pain and disability. According to the report, the diagnostic accuracy rate exceeded 90%. This work opens a fresh path to both understanding the biology of chronic fatigue syndrome and a rational way to develop new therapeutics for a disease. Thank you.